No, I'm not talking about the lectures. The
Acha, acha,
course content, we should not upload any
acha.
course content. Yes, but we
What
have
else
to
should we put
update.
in there? Yeah, we can update.
What we have to update is that how we are progressing in this field, how people are joining, how they are, and their testimonials are there, so people can see, and what are the achievements we have done. Suppose after starting the programs, and what
Yeah,
are our
we can do
futures.
interim summit. Yeah, I was thinking of doing at the end because that
Uh,
will be finished. But we can we can do interim, I suppose. I would think through what we can put in there because what we put there will stay forever. So um uh
Suppose we have thought about the refresher course for 3 months for the participants, and this kind of updates should be so that people could come to know that it is active organization,
no,
which
I
is what.
understand something. I just will put something that is we want to stay like we unless we keep changing, uh we can think about it. I'm not sure. I'm just thinking what we can put in because the testimonial will be best at the end, I'm thinking.
Mhm.
Um uh just because they finish their certificate, then we have one testimonial per student. So that'll be like 10, 11 testimonials we could add.
Mhm.
Then there we can put something about their projects, I suppose, when they finish.
Yes,
That'll
yes,
be
yes,
good. I'm
yes.
just not sure unless we think through what we can put now. Like at the moment, it's still like intermediate, so um, we'll think
Devendra
about it.
bhai, it's 8, so we can start our
Yes.
lecture.
Ah, yeah, go ahead. Sorry.
All right, so it's yes, it's 8 o'clock. I'll begin.
Yes, we can begin. We have everything.
Hey, Jayjinder Surabhai.
Jai Jinendra.
Okay. Okay. So good evening, everyone. You all know me. I'm Naina Mehta, and today is my talk, and it's on attention deficit hyperactivity disorder, which in short is termed ADHD. And I'm sure all of you have heard about this term, this condition. So I'm going to run through the diagnosis and the treatment will be tomorrow. So what are we going to learn today? We're going to learn how to identify the symptoms of ADHD. We're going to identify the comorbidities that go with it, and comorbidities are other conditions that occur commonly together with ADHD. And then I'm going to tell you how we actually go ahead and do the diagnoses. So I'll tell you a little bit about the history of ADHD. So it's been around for a long time. So in the 1900s, people used to call it minimal brain dysfunction. So they thought that the children or even adults that were having these problems of ADHD had some brain dysfunction. Following that, they started making a diagnosis of it through the symptoms, which were like hyperactivity. And then they recognized there was a little bit of inattention associated with it too. And finally, in 1980 is when it first became a condition in the diagnostic manual, which is the manual that we use to make diagnosis of psychiatric conditions or any neurodevelopmental conditions too. And these are mostly conditions that you are diagnosing by certain criteria. There's no MRI or X-ray or blood test that will make that diagnosis. It's basically from clinical symptoms that we see, and then we look at the diagnostic manual and we see, do they meet those symptoms? And if they do, then you make the diagnoses. So it became ADD with or without hyperactivity. Then it became ADHD, and then now it's become, so it became ADHD inattentive, ADHD hyperactive, and ADHD combined. And then in 2013, we now call it just ADHD. And then you say whether it's predominantly inattentive, which is they're having a lot of problem with inattention, or is it predominantly hyperactive? They're very hyperactive, or is it both? So when we come to those symptoms, I'm talking about inattention. So basically, that means somebody who's not able to stay focused for long periods of time. And because of that, they make careless mistakes. They don't give attention to detail, so they do poorly in class. They have a hard time paying attention in the classroom. They also don't look like they're paying attention. So when they're being spoken to, it seems like they're not listening. And then they don't follow instructions. They have a difficult time organizing tasks and activities. And one thing they hate to do is do any tasks where they require a lot of attention. They lose items, they get easily distracted by outside stimuli, and they're often forgetful in their daily activities. So those are 9 symptoms, and these are the exact diagnostic criteria in the manual. So these are the exact things that we follow for the first 9 for inattention. And in the same way, oops, okay, I lost it. Sorry. Devendra, I need you to come and find it. Where is it? So they're the same way. There are 9 for hyperactivity. And those 9 are also diagnostic criteria. And I just want to tell you them exactly how they are in the manual. But basically, the children who are, they're having symptoms of hyperactivity, they're having symptoms of impulsivity, like they can't wait their turn, they're like on the go, like the Energizer Bunny, they never stop being active or running around. And obviously this condition is diagnosed in childhood, so I'm talking about children, but the condition does last into adulthood and in some people. So you might see some people who are coming into your yoga studio who do have this condition, which is why we're talking about it. And so the other things that go with the hyperactive is impulsivity. They cannot control their impulses. They are constantly, there it is. Okay. So how do I make the next slide? What's the easiest way? Just tip on it. Okay. That doesn't work. Oh, it does work. Okay.
You're starting, you're taping it. You have to start again because you're taping the future. You want to start again? Suril, just start again.
Oh.
It's taping the YouTube.
Okay. Suril, bye. Them are the things I should just start from the beginning again. So can we just do a recap? All right, so I can't move the slide with this, Devendra. Sorry. And he's going to repeat it now, so that's just sleeping up. Okay,
Suril is there. Suril is listening to you.
Can you call
You
Suril?
can start again. I'll
Okay.
start again now. It's okay. We'll cut it. Yeah.
You edit it.
Yeah, you can start
Okay.
from now.
Sorry, Samniji.
Yes.
Okay, so sorry everyone. So we'll start start from the beginning. My name is Naina Mehta. I'm a neurodevelopmental pediatrician.
Again, you can start.
It said recording stopped. Okay, so my name is Naina Mehta. Okay, hello everyone. Good evening. My name is Naina Mehta. I'm a neurodevelopmental pediatrician, and today I'm going to talk about attention deficit hyperactivity disorder, which is a very common condition that I see in my office. So today we will be talking about the diagnoses, and tomorrow we'll be talking about the treatment. So what are our learning objectives for today? We'll identify the symptoms that make up the diagnosis of ADHD. We'll identify the primary comorbidities which means conditions that you see commonly in association with ADHD. And we're going to describe this whole diagnostic process. So before I start that, I wanted to tell you a little bit about the history of ADHD. It's been around for a long while. All the way in the 1900s, people recognized children who had this condition. And at that time, they called it minimal brain dysfunction. They actually thought that the children had damage in their brain. As time went on and as they did more research, they realized that there isn't really any brain damage per se. And this is a condition of a lot of combination of symptoms. So hyperactive symptoms and inattention. And so they continue to make diagnoses of ADHD, and it finally went into the diagnostic manual in 1980. The diagnostic manual, which is called the DSM, is a manual that we use as physicians to make diagnoses. It has all the diagnostic criteria that a particular condition has to meet to make that diagnosis. And in the conditions that we see, the diagnoses are made purely by symptoms. There's no blood test, there's no X-ray, there's nothing, no MRI that you can do to make this diagnosis. It's purely by the physician who sees the child, gets the history, and sees if they meet the diagnostic criteria. So it's now known as ADHD, and whether it's predominantly inattentive, predominantly hyperactive, or is it of a combined nature? So we'll start with the diagnostic criteria for inattention. And in here, you see a child that's making careless mistakes, and even an adult who has this condition will be making careless mistakes, pays poor attention to detail, has a difficult time with focused attention. So they cannot stay on a task for very long. They have a difficult time following instructions, and they're not paying attention. So they look like they're not even listening when they're spoken to. They have a very hard time organizing themselves. Any task where you have to pay a lot of attention for a long period of time, they will most likely want to avoid. They lose items that they need for tasks. They get very easily distracted by outside stimuli, and they often are forgetful. So these are 9 criteria. The same way in hyperactivity and impulsivity, there are 9 criteria. So here they're fidgeting in their seat. Often they leave the seat while class is going on, or even they don't even realize that they're not supposed to leave their seat. They're running around or climbing excessively. We have children that are climbing onto high furniture in the house where they could hurt themselves. They cannot engage in leisurely activities that are quiet, like sitting down and reading, or sitting down and making a puzzle, or doing any quiet activity is very hard for them. And they're like Energizer Bunny. They're on the go all the time, driven by a motor. They talk a lot. They'll blurt out answers before the question is completed. They have difficulty waiting their turn, and they interrupt and will intrude on others. So when it comes to making a diagnosis, you have to have 6 out of 9 of the symptoms in either or both categories. So if you're having a diagnosis of ADHD predominantly inattentive, you have 6 or more symptoms of inattention, which was this one. For 6 or more symptoms in this category, you will be diagnosed as ADHD predominantly inattentive. Now, if you had 6 or more diagnosed in this category, and you didn't have 6 in the other category, then you would be predominantly hyperactive. But if you had 6 in both categories, 6 or more, then you will be diagnosed as combined. The condition has to be persisting for more than 6 months. And it has to have been present before the age of 12. So even in adulthood, if they were making the diagnosis, there has to have been some conditions or some symptoms that had been present in that adult as a child. They have to be having these conditions in more than one setting. So it can't be that they have all the symptoms just in their home or just at school. It has to be in both places. And it has to be impairing their functioning, both their social, academic, or if they're an adult, in their work. And obviously it's not explained by any other mental condition. Now, I did mention in adults, so if you're older, then you can make the diagnosis with just 5 symptoms in either of those categories. So moving on to the epidemiology, it's the most commonly diagnosed behavioral disorder of childhood, 1 in 20 worldwide. 3 to 7, actually, since this slide, it's actually almost like 11% of school children are affected in the United States. Males outnumber females by 9 to 1. So it's a very common condition, much more commonly in boys. And actually, all conditions in neurodevelopmental conditions, neurodevelopment means conditions that are affecting the brain in childhood, are more commonly found in boys than in girls. But as you get older and become an adult, it becomes more one-on-one. How does ADHD progress? So as you get older, the inattention symptoms are persisting, but the hyperactivity and impulsivity gets less. So when you see an adult that has this condition, they're not going to be running around the house or climbing on furniture or doing crazy things like that. But what you'll see often is they'll be fidgeting in their seat. They will be like tapping their foot or tapping their hands. And those are the hyperactive symptoms that are remaining in them. Now, when you have this condition, there's a lot of impairment that happens. And to make the diagnosis, you have to have impairment in your life to have the diagnoses. So as a child, it's obviously all related to school. So the child is not doing well at school, is failing in the classes, or is disrupting the class, having to go see the principal a lot, has a problem with making friends. Often they start getting a very low self-esteem because they're constantly being reprimanded, like they're constantly being told off. So then they start thinking that they're not very good, they're not very smart, and so they get very bad image of themselves. They're getting a lot of injuries because in the playground, they won't think about where they're climbing and they'll jump off high climbing frames, often getting fractures or cuts that require stitches. And as they get into the adolescent age, they're starting to have a lot more problem with doing illegal things like substance abuse or smoking. We have a lot of problems with motor vehicle accidents because they're not paying attention when they're driving the car. And then as they become adults, they have problems with their jobs, they have problems keeping their job, and they get into the law a lot. They have a lot of legal difficulties. So it's a very chronic condition and with a lot of impairment. And when I spoke earlier, I spoke about the comorbidities. So not only do they struggle with the symptoms of ADHD, but in 2/3 of the children, as well as in adults, they can have comorbid conditions. The commonest one is oppositional defiant disorder. It's in like 45 to 60% of the children will have this. And what this condition is that they're being very oppositional and defiant. So they start becoming very behaviorally difficult. They'll say no all the time. They'll defy the law. They'll defy other authority people. And that becomes a problem. They can have conduct disorder where they're actually stealing, they're lying, things that they're actually doing that get them into trouble with the law. They can have anxiety or affective disorders, which are like depression. They can have tic disorders, and they can have learning problems and academic problems. So they can often struggle with learning disabilities as well. So as an adult, they are having employment problems. They have a lot of motor vehicle accidents. And the biggest thing is that why all these things happen is because they're having impairment in executive functioning. And what this is that they are not, response inhibition these are the main areas, response inhibition. So they're not thinking before acting. So they're often getting into trouble because they haven't thought about the consequences. They're not very attentive to any tasks that they do. They're not even attentive to things that could get them into trouble. So they don't have any fear. They have a hard time with working memory. And what that is what you need to continue to do a task that you have at hand. So it's like if you have to remember a phone number, a telephone number, you'll remember the number, that's your short-term memory. But at the same time, remembering how to make a phone call, that would be a working memory. So that's just a small task. But if you can imagine bigger tasks that they have to remember certain things in their short-term memory, and then they have to put it to work. Putting it to work is what they struggle with. And then they have difficulties with planning ahead and making any decisions. So they have a really hard time with jobs. So how does ADHD move forward in their life? The natural history is a rule of thirds. So if you're making a diagnosis of ADHD, if I make it in childhood, I tell the parents that a third of children completely resolve, so they don't even have ADHD symptoms as an adult. A third of them will continue to have ADHD symptoms as an adult, mostly inattention with some impulsivity, but a third of them may go on to develop these other conditions that I talked about, in addition to the ADHD, oppositional defiant disorder, poor academic achievement, substance abuse, or antisocial adults. Now, when I told you that there's no diagnoses to be made by imaging, what they have found is to find out why the children are getting these symptoms or why adults have these symptoms has been shown in imaging done that adults or children with ADHD have a smaller caudate nucleus and globus pallidus. They're parts of the brain which have a high density of dopamine. And the posterior part of the brain regions are smaller. That's the occipital lobes, which is what controls your vision. And they have a smaller corpus callosum, which is the part of the middle part of the brain that joins the right and left hemisphere. And so that's the area that's involved in coordinating activities. So they have seen these on brain imaging techniques in children and adults with ADHD, which makes you realize that this symptom is this condition is definitely a condition of a neurological condition and not just a condition of behavior, which is what sometimes some people think. In addition to the imaging, they've also done a lot of studies with genetics, and we know that it's definitely associated with genetics because if a father has ADHD, it's very common for the child to have one of his children to have ADHD or all of his children to have ADHD. It goes down in the genes a lot. And they've shown a lot of chromosomes that may be associated with it. So I've just mentioned a few here. There's a dopamine transporter gene, which is on chromosome 5, and a receptor gene on chromosome 11, and one on chromosome 3. Now, they have shown studies that show this, but we don't do genetic testing on children to see, do they have these genes? Because it doesn't help to know about them having these genes. It's just telling us that, yes, there is a genetic association. And as I said, up to 35% of parents can have a child with ADHD if they have ADHD themselves. Now, there are also non-genetic causes that can cause ADHD. And one is having difficulties in pregnancy, if there's been any stresses in the pregnancy of the mother. If you have a low birth weight child, the child is of very low birth weight, traumatic brain injury. So they've had an injury to their brain in childhood, like they've been in a motor vehicle accident and they've had brain injury. If the mother has smoked or drunk alcohol during pregnancy, we often see children with ADHD. And if there's been severe early deprivation, that means they haven't had appropriate care in their early childhood, then sometimes they can have see symptoms of ADHD, but that has to be very extreme. But I want to just end with a common misconceptions. So knowing all those are the causes for ADHD, we also need to know and need to tell the parents that sugars or additives have not been shown to be causing ADHD. Now, that doesn't mean that if I have a mother that comes with a child and she says that whenever I give a child that's diagnosed with ADHD, if she gives them a lot of sugary drinks or gives them ice cream before bed, they're super hyper. That sometimes is seen. And that's just because it's affecting the transports of the neurochemicals at that time, but it's not actually causing the condition. The condition has already been caused. It's not due to poor parenting. So often when they think that this child's misbehaving because the parent hasn't looked after the child, it's not because of that, because you can have two children in the same family with the same parenting, and one child we see has a lot of symptoms of ADHD and the other child doesn't. It doesn't come from a chaotic home environment. If that was the case, all my kids would have had ADHD. It doesn't come with being on the screen a lot. And it isn't in children who are lazy or lack of motivation. A lot of the time, parents will think the child is just lazy, or the school teacher will think the child is just lazy and doesn't have motivation, but it's not because of that. It's actually they have the condition. Now, we have to make sure that we are making a correct diagnosis. So our appointments are like 2 hours and sometimes 3 hours long, where we're getting a very good history and having a very good look at the child, and then the parents fill out forms and the teachers fill out forms, and then only if everything is correct do we make the diagnosis. So the symptoms have to be in more than one setting. We're never going to diagnose ADHD just on a one-on-one interview. We get information from the teachers, we get information from any other activities that they're taking part in, and we have forms, which I'll go on to next, that we have them fill out, which go through all these diagnostic criteria. So in my office, a child can look very good, and they may not show the symptoms of ADHD. And that's the same if when they're playing video games or watching TV or watching videos. So if a mother comes and says, I don't think the child has the problem because they can sit and watch TV for long periods of time, that's not taking away the diagnosis, because any screen can keep somebody's attention, even a child with ADHD. But it's when they're having to do activities that do not have any screen, that they see the problem. It has to be in group settings as well, not just on a one-on-one setting. So like in a classroom setting. The diagnosis is made using rating scales. Well, they actually help us to make the diagnosis. The diagnosis is made obviously from the symptoms that we see, but the questionnaires that we give for parents and teachers often help us to make the diagnosis, because obviously we are not able to go into the school to see how is this child behaving in the school. So we will send out a questionnaire with the parent to the teacher, and the most common one that I use is the Vanderbilt, and that's the one that's most commonly used. And it goes specifically through all the diagnostic criteria of ADHD, the 9 initial ones, inattention, the 9 hyperactivity, and then it goes through the comorbid conditions. So oppositional defiance, anxiety and depression, conduct disorder, and then also go through performance. So we have a very good idea just looking at this form that the teacher will have filled out as to whether they are seeing the symptoms of ADHD in the classroom setting or not. And then the parent fills it out, so we know how the parent is seeing the symptoms too. And if we have symptoms in both settings, even though the kid in the office may not be showing anything, we will still make that diagnosis. If I see the child in the office running around, not being able to sit in the chair, climbing onto my desk, climbing behind my chair, climbing on my lap, then obviously I'm going to make that diagnosis right there and then. All right, so I think that's all I'm going to tell you about today, because that's all about the diagnoses and the way we make the diagnosis and the background. If anybody has any questions, please feel free to ask. I'm going to stop sharing my screen so I can see you all. Okay.
Excellent lecture. Like, it was very clear, all the conditions, all the myths. Never thought like that. So thank you so much, Naina ji.
Oh, thank you, Anita. Do you have any questions? Anything that's not clear or?
I mean, I think tomorrow treating this condition would be much more challenging, I guess, because of attention deficit and not following the instructions properly.
Right.
So I think we'll discuss that tomorrow,
Yes.
right?
We'll be
Okay.
discussing that tomorrow. And obviously, the reason why I feel this condition is so important in this course is that yoga and meditation can really help. And I've done studies on that to show that it helps. So
Exciting.
definitely there's an answer out there for it rather than just using medications. But obviously, I will talk about all that with the treatment.
Sounds good. Thank you so much.
Okay, any other questions?
I think you went over how
specific
common
knowledge.
this is, but also it's in adults, correct?
It happens in adults, did you say?
Correct. I'm saying it's not just in children, it happens in adults also,
No,
correct?
so that's I kept mentioning about adults. Everything is exactly the same. To make a diagnosis in an adult for the first time, we would have to know that they've had some symptoms before the age of 12. So the diagnosis doesn't just happen in an adult, but what you often see is that in children, especially in children that are smart, they will manage to get through school without having impairment in functioning. Like they won't be failing grades, they won't have any problems, even through middle school, even through high school. And then when they go to college, when they don't have that additional support of, say, the family or the teachers, that's when they start having the problem. And that's when they think, oh my goodness, I mean, why am I doing so badly? And then they realize that actually all through childhood, they did have problems. Like the parents would say, oh yeah, they did have this problem of not paying attention and not always following directions and not doing this and not doing that. And then we make the diagnosis in adulthood. I mean, I don't because I'm not an adult doctor, but if they were going to an adult psychiatrist, they would make that diagnosis in that way, using the same diagnostic criteria. So they have to meet those criteria of both what it most likely would be the inattention side more than the hyperactivity side, because as I told you, the hyperactivity gets less as they go into adulthood, but then they would also have to have the conditions being there before the age of 12. And they only need 5, not 6 of the symptoms as an adult. That was a good question though, because yes, it is diagnosed in adulthood quite often actually, because especially as I said, in the brighter people, they get through school without having a problem.
Right. Nice.
And then they have problems at not being able to keep their job, and those kinds of things start happening, and then they start realizing that, or they get married and their spouse tells them that they're having, this is not right, this is not normal, like they may not even have realized, and they'll and then go send them to see a psychiatrist, and then the diagnosis is made. Or actually, most commonly, they bring their kid in with the problem, and we make the diagnosis in the child, and then they'll say, oh, I was very much like this, I'm very much the same, and then we say to go see an adult psychiatrist, and then they go see the adult psychiatrist, and then they go get help. And until then, they've been struggling in their workplace or whatever they're doing. So.
Yeah.
All right. If we don't
Nice
have any,
presentation, Naina. Thank you.
you have a question, Narendra Bhai?
No, the same Devendra would ask. That's what I was going to ask you about adults also, but you already explained just now.
Okay. So in case you're all worried that you have ADHD after listening to the symptoms, I can guarantee that none of you have ADHD, because you have to be very unsuccessful at your life to have a diagnosis in adulthood.
We wouldn't be able to do the meditation also with ADHD.
And yes, this prolonged meditation actually would be impossible, or any meditation would be very hard to do. Although I take that back, because even my ADHD kids will be able, I mean, they can meditate for like 10 minutes.
Yeah.
So it's a more prolonged task that they're not able to do. And if you make it fun, often they can do things. But obviously, yes, if it's going to be doing this course would not be possible. 100%. Right. They would not be doing this 6-month course if they wouldn't be able to do it with untreated ADHD. It would be very hard. All right, so maybe we can, what's the time? 8:37. Somniji might want to guide us for meditation, Somniji.
Thank you for the wonderful talk. Just I was thinking that Acharya Sri Mahapragya Ji has introduced one education policy, and he has developed the whole science of living course for balancing the function of the brain. He used to talk that most of the education which is going on at present in all the different universities and colleges, they are just focusing on the left hemisphere and not the right hemisphere. So if we can give such good values and meditation to the child, so he can have very balanced development of his life and brain. and the right hemisphere can also be activated by the meditation in yoga.
Yes.
So there
And
is
I think that would be
yeah. So he has done experiments at a school level, university level, college level, and this has given very wonderful results. Those children who were very naughty, or you can say undisciplined, involved in some wrong activities, they got controlled just by meditation sessions given only
wow.
3 days in a week
Yes,
for 3 months.
I
So
can
that kind
imagine.
of a pilot project has been completed in Delhi in 5 schools.
Okay.
And after we have also done such kind of other project, so in which we have taken other 5 or 10 schools, and we have got good results of.
Amazing, Somniji. That's actually
Yes.
that's the science of living that we're teaching the Gyanshala kids,
Yes.
or different science of living.
Yeah, the same science of living.
The same science of living. Actually, we need to tell our Gyanshala parents the
Correct.
study.
So it is being introduced from primary to higher secondary, then college, then university level. So we have all different packages, or you can say course curriculum for all these age groups.
Right. Wow,
There is
that's
very good
incredible.
results. And hundreds of schools have been, this course has been offered in many schools of different states of India, and all have got very good results. Just they were given 20 minutes yoga practice in prayer time, just 20 minutes. And there is amazing results of that.
Amazing difference, right? Yeah.
Correct.
I think all of that has, in the olden days, even in this country or in England, they had prayer sessions and things at the beginning, like in an assembly. They used to have that. Even I remember going to assembly and doing a prayer or something. But now, because of all the concerns that they have of, different cultures and everything, that doesn't happen anymore. Nobody even thinks about doing that kind of combined session for the whole school at the beginning, or even with some exercise or doing something where they're using the right side of the brain. They go straight to class and they do the straight learning. So I think it's a thing that needs to come back.
It is necessary in all educational systems. If there is a 1 hour, a half an hour, suppose, including the prayer of the school, if there is 20 minutes at least yoga practice, 10 minutes meditation, and 10 minutes physical exercise, that will help a lot to the child to grow in a very balanced and disciplined way.
Right. Because they've shown that it's the communication between the right and left hemisphere, which is a problem for ADHD kids.
Yes.
So this is actually treating, and also all the yoga, all the meditation that we do is actually affecting those neurochemicals in the brain, which are the ones that are lacking in ADHD. So, the dopamine and the noradrenaline, and helping with those. So I think that that's also what can help.
It is it is now the government or those school, university, college authorities, they have to think about how child can grow in a very balanced way in his life. And for that, meditation is must for even for the child.
It's a must, yeah.
They can do a very simple meditation and for very short time, but that also help a lot to them.
Right. And if you start young, and even if you just do 5 minutes initially as a child, and then you slowly increase to 10, and then as they get older, they are able to do it for longer. It's beginning as in childhood. That's the important thing.
Yes. Even in Jain Vishabharati University, it is the university where the people come for master, for their PhD or MPhil or DLED, etc. So in the prayer, we give meditation. even to the master students.
To the master, yeah.
Yeah, it is mandatory for them.
Yes. Wow. Okay, so all the students do it. Yes.
And that's why the students who come out of J. Bharati University, they are getting very good placement because of their
Yes.
disciplined behavior.
Yes. Yeah, I think there is a lack of discipline, that's for sure. So that's where these children do struggle.
Mhm.
I'll talk about that tomorrow.
Yeah, just loading them classes and classes, engaging them. So they are getting stressed because of that.
Mm,
The times that their mind is engaged, it is not getting rest actually.
mm. Doesn't get rest, it's just constantly on the go.
So thank you very much for the wonderful talk.
Okay, thank you, Samniji. Andami Samniji.
Thank you. So now it is the time for meditation.
I think so. Yes.
Yes. And I'm thinking, not for today, but just from tomorrow, everybody has to give one meditation for half an hour.
Half an hour.
Okay, yes. So because we
Okay.
have time at least a half an hour, no? The lectures get finished
Yeah, they get in. We're only
8:30,
half-hour
8:30, and
lectures.
there is hardly 15 minutes for question answer, but we have at least up to 9:50, so you can
Yes.
give the full meditation,
Mm-hmm.
and that is the part of your final exam. I'm starting my final exam. Okay. So just one meditation. You can look at the book. There is no problem. But you have to give full meditation.
Okay.
Okay.
Okay. So who is starting from tomorrow?
I can do tomorrow.
Okay. So for today, we will practice meditation. We
Give us
have
an
started
example.
meditation on chakras.
Mhm.
And for ADHD, actually, we need more and more breathing, long and deep breathing perception.
Deep breathing. Mm-hmm.
Yes, for the child also. But right now, we are focusing on a chakra meditation, or you can say the perception of psychic centers. So sit in a comfortable posture. Keeping backbone and neck erect. Both the hands in the posture of knowledge. Close your eyes softly and with 5 Om sounds start meditation. Om. Om. Relax. Relax your entire body, mind, and vocal cord. Before starting meditation, make the resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of Praksha meditation is Kayatsa, relaxation with full awareness. Concentrate your mind on the big toe of the right foot, starting from the toe up to the head. See each and every organ, each and every part. Experience all the vibrations, sensations, functions of the part. Give suggestion to be relaxed. Gradually and slowly attain the relaxation in each of the parts. Now feel complete relaxation throughout the body, from toe to head and from head to toe. The whole body has get completely relaxed. Now, the second step of meditation is perception of psychic centers. Focus your attention on the heart, the center of bliss, entering from the front. Allow the beam of searchlight of consciousness to extend in a straight line up to the spinal cord. See the whole passage from front to back. And concentrate on the big part, that is the location of the center, and feel vibrations of the center. The vibrations produced by the flow of vital energy in the entire region. To make the exercise more effective, hold your breath for a while and thereby make your awareness of the vibrations more profound. More the psychic center for bliss is active, more the child or adult is happy. Now focus your attention on Vishuddhi Kendra, that is the psychic center for purity, located in the center of your throat. Concentrate deeply inside the throat. Entering from the front, allow the beam of searchlight of consciousness to extend in a straight line up to the spinal cord. Be aware of the vibrations produced by the flow of vital energy in the entire region. To make the exercise more effective, hold your breath for a while and thereby make your awareness of the vibrations more profound. You can visualize hum mantra in a sky color inside the throat on the center. Hum. It is a seed mantra for a space element. Visualize hum in a sky bright color. Experience the energy of the center. It is getting purified and awakened. Now focus your attention on Brahma Kendra, psychic center for celibacy, located in the frontal part of your tongue. Concentrating the attention fully on the tip of tongue, be aware of the vibrations produced by the flow of vital energy in the entire region. Concentrate deeply on the tip of the tongue. This is the place of Udan Pran. Mind has close connection with this part. Mind can be controlled by controlling the tongue. Make the experience more effective. Hold your breath for a while and thereby make your awareness of the vibrations more profound. Now concentrate your mind on Prana Kendra, the psychic center for vital energy. Located on the tip of the nose, concentrating the attention fully on the tip of the nose. Be aware of the vibrations produced by the flow of vital energy in the entire region. It is the place of prana energy. Vital energy. To make the exercise more effective, hold your breath for a while and thereby make your awareness of the vibrations more profound. Feel the active energy of the centers and see which center is more active. Now focus your attention on Chakshus Kendra, Psychic Center for Vision. Concentrate on both the eyes. See one by one. Focus on them. See from front to back. Eyes are very active center of consciousness. Consciousness is working through eyes, through ears, nose, tongue, and skin. Up with brain. See both the eyes. See the eyes from front to back and feel the vibrations of consciousness. See the vital energy working in the eyes. The power of vision can be increased by focusing on the eyes. Now focus your attention on Apramad Kendra, Psychic Center for Vigilance, located in your ears. Concentrate on both the ears. Concentrating the attention fully on the outer, middle, as well as the inner region of the ears. Be aware of the vibrations produced by the flow of vital energy in the entire region. Make the exercise more effective. Hold your breath for a while And thereby make your awareness of the vibrations more profound. Now we will look into all the centers. See, they are getting activated. They are becoming active. Now, with 2 long breaths, we will conclude our meditation. With 2 sounds, conclude the meditation. Om.
Om.
Hands and keep on the eyes. Open your eyes gently. So, how was the meditation, Naina?
It was good, Samniji. I think I was getting a bit lost in the middle, like not staying focused.
Mm-hmm.
But then again, when your voice comes, it brings me back again. But it was good.
Okay.
Samiji, we don't look for colors at any of the centers, right? Just focus
Yeah.
on the
Doesn't do
location
any
and
color.
vibration.
Yes, yeah, it is not required, but it's like the Naina when the mind wanders here and there sometimes. So we are giving
Okay.
some new tips so that your mind should be engaged in that meditation.
Got it.
I very
Yes.
much need a voice, Samniji, with
Huh?
meditation. I very much need a voice. Like when I try to meditate by myself, it doesn't work. But if I have that video on and the Samniji is talking, then I am staying in the focus.
Okay, but this time I'm giving meditation, so why
Exactly. So I need the voice. So that's why I still it was it's then only when your voice is there, then I'm able to stay.
Yeah, it happens. Don't worry. But just I'm telling that color meditation is also very good. If we can aid colors, but if our mind is wandering, otherwise pure perception is enough.
Okay. Just trying to see.
Yes, to awaken the inner powers.
Mm.
So like the color or other things are just guides, but you don't need them if you can get through without them.
Yes, that is the more effective. That is the more effective, but since our mind is not so much concentrated, for longer period on one thing. So we ate somehow so that you can be connected. But they are the interfaces actually. Okay, interfaces till your mind is fully concentrated for pure perception. You can take the support of the color, of the mantras, some object. Clear? Yes.
Thank you so much.
Yes, so that the meditation which is taken by each one of you for your presentation, you have to give meditation on the same topic. Okay.
Okay.
Yes.
Every trying to, if your question is done, if you haven't yet, that I sent so that you've got some baseline. Next day or two will be okay.
Sorry, you're
And,
asking me?
No, I sent questionnaires to compare now and later. So if you can remember, do the questionnaires the next day or two. I send them in the yoga web page. The same question some of you checked for
Yes, I have
spirituality.
checked.
Yeah.
Yes, I have checked.
Just reminding people to make sure they do them
Yeah,
their
I'll
own
do it.
before and
Yeah.
after. Yeah.
Okay. Thank you very much.
Vandami Namasami Samji.
Vandami Samiji.
Vandana Samiji. Okay, bye.